Hannah, tell me a little bit about yourself.
So my name's Hannah. I'm a fresh graduate of the radiation therapy program at the University of Alberta, and just started my first casual role as a radiation therapist at the Cross Cancer Institute. So very fresh in my career. And I have a background in journalism as well, where I graduated in 2015 with a photojournalism diploma and worked in various roles through Alberta as a multimedia journalist, where I got lots of great opportunities pursuing a lot of different passion projects as well as work in the community. As a student, I also centered on research in the area of transgender and gender diverse patients. So for me, I would say social accountability relates to leveraging my own personal power as well as my experience and position to advocate for and with patients who maybe are somewhat falling through the cracks a little bit, who don't have the opportunity to advocate for themselves a lot. My background as a lesbian cisgender woman, I have some experience being on the margins, and I don't know the experience specifically of transgender and gender diverse people. That's not my experience, but I have a lot of friends and family that identify that way. So within my clinical experience as a student, it was pretty easy for me to recognize some of the gaps in care for those patients. For example, cancer care is extremely gendered. There are some certain cancers that are considered male cancers and certain cancers that are considered women's cancers, such as gynecological cancers. So I saw that and I wondered where my loved ones would fall, how they would be cared for. As a student, I initiated a really ambitious research project centered on patient care of transgender and gender diverse patients. And so me and my research partner, we conducted a series of interviews as well as a national survey in which there was multiple choice questions and open responses. And we got a really rich data set on current care practices and were able to develop a really good picture of how things currently stand. Some of the conclusions that we reached were that radiation therapists are really willing to do the work and go the extra mile for really any patient group. But for this patient group, they don't necessarily feel equipped with the right level of knowledge or the right skill set. And there are also significant barriers in being able to provide this care. So I think that was a really valuable starting point for potentially for future research, just to have an idea of where we're standing now and kind of where we need to get to perhaps. What is next for me in that research? I would really like to publish my research. Some of the therapists that we interviewed said that, yeah, they've had those difficult, frank conversations with some therapists about the importance of respecting pronouns, the importance of inclusivity. I would also love if my research can be a part of developing some sort of training program for radiation therapists in terms of how to care for trans and gender diverse patients. Obviously, our research didn't encompass the perspectives of that patient population, so we would need to incorporate a lot more research to do that. But I think it's a good starting point to just know kind of where we're at, to have a good picture of the current care environment. And in terms of, for me personally, I'm always going to continue to do the work to advocate on a day-by-day basis, patient-by-patient basis. I wear my pride flag, I wear my pronoun pin, and it's not necessarily enough. I think it's a really good starting point just to signal that I'm a safe person and this is a safe environment, at least in this bubble, for patients to be able to come out to me if they choose to, for them to feel safe in my presence, knowing that they can talk to me in a way and I'll get it. I think it's also really important to shift the culture amongst staff, amongst radiation therapists. So even just signaling that to other therapists, that I am a person that's willing to have those conversations. If they want to come and ask me questions, they can feel free to do so. I think it's really crucial to weave social accountability throughout all of a therapist's training, not just so it's a checkbox at the end of a program, but so that people have an ingrained sense of social awareness, so that they're able to kind of recognize those gaps in patient care and have the skills as well as the empowerment to do something about it.
So I'm a Métis radiation therapist. I come from Treaty 2 in Manitoba. I ended up getting into radiation therapy as my sister progressed in her own journey with cancer. and I now work at the Tom Baker Cancer Center in Calgary, and I've been there for, I think this is my 17th year.
So what does social accountability mean to you as a practicing Métis radiation therapist?
So I think it's twofold for me. So number one, it is about modeling behavior to staff and students about what does it look like to connect with an Indigenous patient who's coming in. Due to the historical nature of what Indigenous people have experienced in Canada and in Alberta, it can be a really scary place to come into. You're away from your community, away from those traditional pieces that ground you. And then I think the second part to that is the educational piece. It's about creating an environment where people feel really safe and secure to ask you anything. I think there's a lot of mud of misinformation, and sometimes that can be really overwhelming. And what I hear from staff is that they're scared to offend somebody. They're scared to ask a question that might be offensive or might be inappropriate to ask.
And then you took that a step further, I think, by seeing the gaps in the education and the...
Yes,
Yeah.
yeah. So what actually had happened for me was in 2020, I do believe, is when the bodies were starting to be found at the residential schools. And by this time, I was already sort of stepping into that role at work of trying to create this environment for staff to feel comfortable to come talk to me about questions that they might have. And so as the staff were starting to talk about this and I was starting to ground myself in my own practices again, we ended up doing a survey just of the practicing therapists in Alberta, just to see where they were. So Alberta Health Services has a group of mandatory Indigenous modules that you have to do. And we started kind of seeing those gaps. So people had done the modules and had really wanted to understand, how do I now take the information? I understand the historical context. How do I now take that and move that into practice? And so as we were having these discussions about the bodies being found, this is where I started to really see gaps in the translation of what the modules were designed or intended to do. So after we did that little survey, we looked at the results and realized that even though 90% of radiation therapists had done the modules, 70% did not know where to find any resources, would not know how to connect Indigenous patients with the Indigenous patient navigators, or just even what was available online, not only even for patients, but also for them to continue the education. So we ended up taking that information and applying for a grant where we started looking at what was the experience of Indigenous patients, particularly Indigenous survivors of cancer. How did they feel their experience was in the radiation therapy departments in Alberta? And what we heard was that it wasn't really nice, and that we unintentionally had caused more trauma to patients and didn't meet them in their needs, that they were attempting to talk to us and attempting to tell us their stories and connect with them, and we're not able to find the spaces and places to do that. So from there, we ended up developing a pilot project where we took our senior students in the radiation therapy program here at the University of Alberta, and we were invited by an elder. He is an elder here in resident with the College of Medicine and Dentistry, and he invited us to come out to his home. So we went to his traditional lands, and we were able to take part in a sweat lodge ceremony. And I think that really allowed the students to see things in a different way. When you are invited into someone's home and they open up that space for you, the transformation was incredible. Then on a bigger level, I've been able to help develop a course for the National Governing Board. And so I break down each of the grandfather teachings, the animal that represents the teachings that ground Indigenous people in North America particularly. I use that as a basis to then tie into how to be human in healthcare and how to have a person approach and a human approach. For me, that social accountability piece is about the administrative people creating the time for staff to do that. I think when I look at the online modules, a beautiful piece to have followed that up with would be to do a traditional blanket ceremony. Now, a traditional blanket ceremony is 3 hours. And so from an administrative level, they say, yes, we would love for you to go do this. However, how do we create the time for that? And I think you just need to work that into your strategic planning. If we're talking about having a strategic planning and telling Indigenous patients, especially in cancer care, that we're changing the landscape, that we're changing the way that we approach things, then we also need to have a commitment to that.
My name is Cynthia Palmaria, and I am one of the faculty in the radiation therapy program at the University of Alberta. So I've been part of the program since we started in 2014. I'm also a founding member of Migrante Alberta, which is a not-for-profit organization that advocates for the rights and welfare of Filipino workers. I'm also a board member of Alberta Workers Association for Research and Education, which is, again, an advocacy group that conducts research and education on the rights of all workers. To me, social accountability and social responsibility is an opportunity for me to be able to merge my interest as a community organizer, as an advocate, as an educator in radiation therapy. And so, for example, in the practice that I do in radiation therapy as an individual, being a Filipino and a product of migration, I was able to see how my connection with migrants or patients of different backgrounds has helped to make the patients at ease. For example, if I had to translate where they can speak more comfortably about their issues and concerns, if they needed some kind of support, that's something that I know as an advocate, I'm able to support them and kind of direct them to the resources that they, as patients and their family members, can go to for support, making this journey a little bit easier for them. As an educator, I think that I have an important role in raising awareness to our students about the deeper context of the roots of inequity and the lack of access to the same the healthcare opportunities for migrants and refugees and the undocumented. And so I think for our students, it's important for them to be able to understand the situation of our patients, right? Especially the ones who are vulnerable. Through Migrante, where I am able to work and spend a lot of time with migrant workers, we were able to do advocacy in different levels. Within the policy level, we've been able to work on the access to healthcare. As I mentioned earlier, Amanda, some of these migrants, they have lack of access to healthcare, especially when they become undocumented and have lost their status. And so one of the work that Migrante has done was to campaign within the provincial level the access of Canadian-born children of undocumented mom. And we've been able to win that campaign. And so these Canadian-born children have been recognized by the province of Alberta and now have access to services like healthcare.